Hello everyone. So today we will discuss about the corrosive poisons. Part 1, Inorganic acids. Now what are corrosive poisons? A corrosive poison fixes, destroys and erodes the surface with which it come in contact. They act by extracting water from the tissues and coagulate cellular proteins and convert hemoglobin into hematine. Now, what is the classification of corrosives? We have learned earlier, but now we will learn it again. So the corrosives are classified into strong acids, strong alkalis and metallic salts. Now the strong acids are further divided into mineral or inorganic acids. Examples are sulfuric acid, nitric acid and hydrochloric acid. So today we will discuss about the inorganic acids and the other type of inorganic acids. Other type is organic acid, that is carbolic, oxalic, acetic acid, etc. Strong alkalis, the examples are written here, and the metallic salts. Example are zinc chloride and ferric chloride. We will discuss them in separate lecture. Now, which is more dangerous, corrosive acid or alkali? Answer is alkalis are more dangerous because they produce liquefaction necrosis, which results in deeper penetration. Whereas acids are less dangerous as they produce coagulative necrosis. It results in hard scar formation, which prevents deeper penetration. So the first is sulfuric acid. Synonym is oil of vitriol and H2SO4. Physical appearance of sulfuric acid. It is colorless, odorless, non-fuming, oily liquid. It is hygroscopic in nature, that is, it has great affinity for water with which it reacts violently and produces intense heat. Commercial sulfuric acid is usually brown or dark in color. Fatal dose of sulfuric acid is 5 to 10 ml. Fatal period is 12 to 24 hours. Mode of action. It produces an exothermic reaction when it comes in contact with moist skin. The heat together with corrosion causes coagulative necrosis of tissues on contact. Signs and symptoms. Now, the corroded areas of skin and mucosa shows brownish black discoloration due to acid hematine. Tongue is swollen, sodden and black. Teeth are chalky white. Burning pain occurs from mouth to stomach. Pharyngeal pain is most common presenting symptom. Feeling of intense thirst. Vomitus is coffee ground colored due to altered blood and contains shred of charred mucosa of stomach. If coincidental damage to larynx, it leads to dysphonia and dyspnea. If acid spillage during swallowing, it leads to corrosion at the site of spillage. Contact with the eyes lead to conjunctivitis, corneal edema and ulceration. Inhalation of fumes lead to rhinorrhea, cough, etc. If perforation it results to chemical peritonitis. Long-term Swickley-like stricture formation in esophagus. Now the treatment. Treatment part is, first we have to follow the Scandinavian method, that is stabilization and evaluation of patient and maintain airway breathing circulation. Then the decontamination is done by using irrigation of area of skin and eyes with plain water and normal saline. Demulcents can be used. Examples of some demulcents are egg albumin, milk, because they form inert viscous coating over the mucosa of stomach. Tracheostomy can be done if there is edema of glottis, and prednisolone 60 mg per day may be given to prevent esophageal stricture and shock. Now, following measures are contraindicated in all inorganic acid poisoning to prevent rupture of wall of stomach. The oral feeds should not be given. Induction of vomiting is contraindicated. Stomach wash is not done, and use of activated charcoal is not done. Use of strong alkalis, it should not be done because it produces large amount of carbon monoxide, which causes abdominal distension and increases risk of perforation of stomach. Now the autopsy findings. External autopsy findings are same as antemortem external findings. Internal findings. The upper digestive tract is inflamed and swollen by edema. Esophagus is relatively resistant to acid. In stomach, the findings are as follows. It is soft, spongy, black mass, thinned out and readily disintegrates on touching. I will show you image in the next slide. Perforation of stomach leads to chemical peritonitis and corrosion of internal organs. Lower GIT shows less intense changes. Calcium oxalate crystals may be seen in the contents of stomach or scraping of mucosa. So this is the image of a stomach mucosa. You can see the black colored stomach mucosa due to acid hematin, and there is tongue in the upper area which is black, sodden and swollen. Now the cause of death in the poisoning by sulfuric acid. First is circulatory shock. The second is spasm or edema of glottis due to trickling of acid. The third is toxemia. Fourth is perforation of stomach leading to chemical peritonitis. And there may be a delayed death may occur due to hypostatic pneumonia and secondary infection or renal failure. Now medical legal importance. It is mostly accidental. It is mistaken with glycerine or castor oil. It is also an abortifacient. Now what is vitriolage? Throwing of an acid on the face or body of a person with intention to blind, disfigure him or her. Section 326A of the IPC. It deals with the vitriolage, voluntarily causing grievous hurt by use of acid. The punishment is 10 years to life plus fine paid to the victim. Sulfuric acid gets its name, that is oil of vitriol, due to vitriolage. Other substances used are corrosive acids, alkalis, irritant juice of marking nut. The treatment is thick paste of magnesium oxide is applied to the affected area after washing with plenty of water and soap or sodium or potassium bicarbonate. This is the image of vitriolage. The movie Chhapak was based on vitriolage. This is Lakshmi Agarwal. The role of Lakshmi Agarwal was played by Deepika Padukone in the movie Chhapak. Now we will discuss about the table of differentiation of other corrosives. The first point is synonym. Synonym of sulfuric acid is oil of vitriol. Nitric acid is aqua fortis or red spirit of nitre. And the hydrochloric acid synonym is muriatic acid or spirit of salts. The physical appearance of acid are as follows. Sulfuric acid is odorless, colorless and non-fuming liquid. Nitric acid is clear, colorless, yellow fuming with peculiar and choking odor. And hydrochloric acid is colorless, fuming liquid with pungent odor. Fatal dose of sulfuric acid is 5 to 10 ml, nitric acid is 10 to 15 ml and hydrochloric acid is 15 to 20 ml. Fatal period for sulfuric acid is 12 to 24 hours, nitric acid is also 12 to 24 hours and in hydrochloric acid it is 18 to 36 hours. Post-mortem appearance of mucosa. In sulfuric acid the mucosa becomes brown or black color due to acid hematin. In nitric oxide it is yellowish but it becomes brown to black color due to acid hematin, and in hydrochloric acid it is grey white but becomes brown to black color due to acid hematin. Now special points is in sulfuric acid we have vitriolage, nitric acid shows xanthoproteic reaction and the hydrochloric acid is natural constituent of stomach.